You're welcome. Well, it's a kind of a reuniting tour. I've been stuck in my Zoom room as like many people for 6-8 months, and of course met with people from Schreiber during that time and worked on many issues that Schreiber is facing, but I haven't been able to talk to people. So this is my first opportunity to get back into the riding and talk to people, and it's just been so delightful to see people face to face, and we're all trying to figure out, do we give each other elbow hugs? Can we hug as human beings?
Have you been vaccinated?
Yeah. And everybody's like, I'm double vaxxed, and then I say, I am too. And then there's a hug that ensues, and we know nobody knows anymore if we're breaking the rules. But people are just so relieved, I think, to be able to see one another and gather again, and that feels amazing.
Yeah, it's been a real big change in people's attitude as well.
Yeah, it's really hard, that human beings are not meant to be stuck alone in our rooms, endlessly without being able to support each other. And communities, especially like small rural communities, they rely on that connection. They're even smaller. They don't necessarily have that isolation that's kind of built into big city living. If you live in a condo in a big city, you for sure probably don't even know the person in the condo next to you. But in Schreiber, everybody knows everybody, and there's little groups of friends that gather, like here today in Robin's Donuts, to shoot the breeze and talk about what's happening. There's community events, there's barbecues, and that is the gel that holds a community together.
Yeah, I can't imagine living in apartments in Toronto and stuff like that, and feeling that it's literally like you're in a box and contained, because even in a small town you have a little bit more leeway to move around.
That's it. I lived in Toronto for years when I was a young 20-something, and the challenges of getting from point A to point B in the city of Toronto, it could sometimes be 45 minutes to an hour to get to your friend's apartment. So by the end of it, you're kind of, okay, well, what's the point? I'll just stay home. So there is a bit of isolation built into a big city living, but part of the lifeblood of a community, a small community, is that ability to gather. So this vaccination is our path to being able to continue to see each other. And thankfully, Thunder Bay District has a really high rate of vaccination, and I have to thank the District Health Unit and all the partners all across, all the health providers that have been stepping up to get, offer clinics and get into seniors' residences and do the job.
We're going to see a bit of socializing a little later this afternoon if you come down to the Senior Centre barbecue.
I'm excited. I'm really excited. Seniors centers have been particularly hard hit, but I have to say I've met with seniors groups, including here all across the country, who have pivoted in a really incredible way. You wouldn't think seniors could adapt to technology that quickly, but I met with seniors from Schreiber, I met with seniors from all across the North Shore in these Zoom rooms. And they told me about how they use that little bit of extra money through the New Horizons program, which funds seniors isolation programs, to connect people so that they could still have, for example, their knitting club, but it just happened to be they were in their own homes, but they could still knit together on Zoom. So I have to say, this is the one thing I will say that I'll never forget, is the resiliency and the compassion of Canadians coming together for each other, trying to figure out solutions so quickly on a dime, figuring out who's not getting food, who's not getting service, who's not getting help, who's not getting connection, and then filling those holes. And there's millions of those stories across the country. It's moving, actually. We're visiting the train, the restored train, and the visitor center. As you know, there was spent more money in that to help make sure that we could restore that train and keep that history of Schreiber and its connection to the train sector alive. I know there's lots of people that have been employed by both major companies, and it's been an honor, actually, as a Minister of Labour, to represent those unions that have protected the workers from this area. This area has also lost people as a result of the work. It's often dangerous. It can be long, and I think it's a great memorial to the community's contribution to Canada's transportation sector. And that's what people don't realize about these small communities. Schreiber, most people wouldn't even know where Schreiber is, but then when you think about the intersection of Schreiber and transportation and the train sector and the contributions of engineers and train workers for, I don't know what the right name is, but you know, folks that work on the train, engineers and the many different folks that keep the train running. The stories here are incredible, and I've had a chance to get to know some of the people that work in that sector through Schreiber, actually. So when I was the Minister of Labour, what an honor to be able to say, well, actually, I'm a community full of Teamsters that are, you know, activists in the area of worker safety, you know, the right equipment, making sure, thank you, making sure that, you know, workers have the continued and ongoing right to collective bargaining. And that's part of what our government did. If you remember, in 2015, it was the first piece of legislation we introduced was to restore collective bargaining rights in this country. Thank you. This is the first stop. We went to Nippigan and Red Rock a couple weeks ago, and very low key so far.
Okay, we'll do a walkthrough. Film is 17 minutes.
Oh yeah. So great. It's beautiful, hey?
This is happening every Thursday.
Those months where we were stuck in our house, like from December till end of June, I was pretty much, well, I was on lockdown like everyone else.
Like everyone.
Thank you. For the pandemic, to bring everybody
Oh my
together
gosh,
like
we
that.
had so much fun.
Where can I put your bag?
My committee is amazing. I have to say, my committee is amazing.
You know what?
It's Ted and Vice Chair are new to it.
I don't know what to do with them.
We can't do it forever.
I know. But you know, it keeps a good shape. I don't know what I'll have to do if it hasn't.
It's a breezy day.
Mine's with words, yours is with fists.
Yes, some days. Some days.
How's your going?
Everybody's got
Your business is okay?
Yeah, we need everything to start getting back.
I just running out of pills because I do feel.
Thanks for the question today about pharmacare. Yesterday, I was in PEI and we signed our first agreement with the province about a national pharmacare program with the province of PEI, who has some of the worst access in the Atlantic Canada provinces, and 29 different public plans. Lots of people that have coverage, but really high copays, so meaning they still can't access the drug because the 40 or 50 bucks or sometimes more prevents them from getting that access. And so we committed $35 million for the next 4 years to work with PEI on a plan to ensure that everybody has coverage no matter what. And that's the vision that I have for National Pharmacare Plan, is that even though it's complicated, there's 100,000 drug plans in this country, that we figure out a way to make sure that no one goes without their medications. And it's going to look, I think, a little bit different from province to province, but the exciting part is now we actually have a physical project that we're actually doing. We've done a lot of research and study. There's the Hoskins report. Of course, Eric Hoskins recommended National Universal Pharmacare. We agree that's what it should look like, but even with saying that, there are many different models that you could take. Is it about, you know, bringing up the folks that have no coverage? Do we replace coverage of people that already have it? That could be quite expensive and maybe not as effective. What does the basic formulary look like? What should be covered in a Canadian drug formulary? That's the list of drugs that would be covered by the government. And then finally, what do we do about all those plans? And is it about making sure that if people have plans with high copays, then somehow we fill in that gap and cover the copay? So you can see that it sounds really easy on the surface, but the more that I've done this and researched this and read about how to do do this, especially given how complicated coverage is right now, the more I realize that it's probably not a one-size-fits-all, and that we're going to have to work province by province to make sure we don't disrupt things that are already working, but make sure that those folks that are left behind or have inadequate coverage have what they need.